The meniscus is the shock absorber inside the knee. It sits between the two bones. Oftentimes it's injured during either flexion or pivoting. They'll complain of clicking, catching, or locking, or their knee will give out on them. A meniscus tear is fairly common. It can happen in just about any sport. It can even happen in a non-sport related item. I've had people who have been sitting on a couch with their knees kind of hyperflexed underneath them, and they go to get up, but they can actually, when they straighten out their leg, create a tear. So the meniscus can be torn in multiple different ways. You certainly see it in athletes, but you also see it in people who are not necessarily doing any athletic event. If they've had a planted foot and twist on it and they create like a little rent or a tear in the meniscus, that can then go on to tear a little bigger and become more problematic. So the recovery for a meniscus tear when we're trimming out a small piece is actually fairly quickly. Oftentimes, if it's been catching in their knee, I tell my patients they'll wake up feeling better in the recovery room, but their true recovery can happen over the next 2 to 6 weeks. However, the meniscus that needs to be repaired, you have to be very protective of. They will take more like 4 months to fully recover. The best way to prevent any meniscus injury, or actually any knee injury, is to keep the knee as strong and flexible as possible. If you keep the knee supported by all the muscles, including your core, that oftentimes will be a good way to prevent any injuries.